Good afternoon, everyone. So today we'll be covering photosensitive disorders. So first we come to the sunlight and skin. It's a major source of UV, ultraviolet light, and visible radiation interacting with human skin. UV radiation, three types: UVC 200 to 290 nanometers, UVB 290 to 320 nanometers, and UVA 320 to 400 nanometers. अच्छा, कुछ भी if you want to ask anything, feel free to ask after lectures. ठीक है, शर्माना नहीं है. तो ये आफ्टर क्लास पूछना है या बीच में हैंड रेज करके पूछ सकते हो. Visible radiation 400 to 760 nanometers, infrared radiation 760 to 1 lakh nanometers. The normal effects of sun exposure on skin are as follows: sunburn, tanning, photoaging, vitamin D synthesis. मुझे याद है विटामिन डी का दूसरा नाम क्या है? हाँ हाँ, calcitriol. So then we come to the skin phototypes. There are six types. First one is it always burns and never tans. Then second, always burns, minimally tans. Then three, burns moderately and gradually tans. Four, burns minimally and always tans. Then five, burns rarely and severely tans. And six, deeply pigmented. And the Indian skin phototype is type 4 to type 6. This is type 1 है. So type 1 means the Caucasians, Europeans. So उस type. So as you go from 1 to 6, skin tone darkens. Then now we come to the classification of photosensitive disorders. First is genodermatosis. This includes xeroderma pigmentosum, Bloom syndrome, and Cockayne syndrome. And idiopathic, polymorphous light eruptions, actinic prurigo, and solar urticaria. And phototactic and photoallergic reactions. These are reactions induced by topical or systemic drugs, chemicals, or contactants. Then continuing with the classification, metabolic such as porphyria and pellagra, tumors such as basal cell carcinoma, squamous cell carcinoma, melanoma, and actinic keratosis. And diseases aggravated by sun exposure include lupus erythematosus, rosacea, dermatomyositis, acne, psoriasis, pemphigus, atopic dermatitis, airborne contact dermatitis. So here's a photograph of genodermatosis showing multiple freckles, lenticules with atrophy, and multiple tumors. Then polymorphic light eruption, which is idiopathic. This is characterized by hyperpigmented plaque with hyperpigmented rim. Then metabolic, diffuse erythema and scaling with classical Casar's necklace as seen in pellagra. Pellagra is due to which vitamin deficiency? नाम क्या है इसका? और क्या होता है उसमें? 3Ds होती है. और बाद में होगा, डायरिया भी होगा. So in pellagra you see diffuse erythema and scaling with classical Casar's necklace. Porphyria, seen by scarring and atrophy on face and dorsi of hands following blistering in a case of porphyria. Then we come to tumors. This is a basal cell epithelioma. Here you can see a rodent ulcer and a nodular ulcerated lesion with rolled out border. Then diseases aggravated by sun exposure, systemic LE. This is a malar rash in the case of SLE. And melasma, hyperpigmented patches on the cheeks and bridge of nose. Then rosacea is seen by erythematous plaques on the central part of face and cheek. Note the swelling of the nose. In polymorphous light eruption, this is the most common photodermatosis. It's idiopathic, probably immunological. It's seen in younger age and more commonly in females. And there are recurrent psoriatic lesions on photo-exposed areas within minutes to hours after sun exposure. Photo-exposed areas include the neck area, forearms, and legs, or mostly forearms, and back of neck. This area is called V of neck. Then clinical patterns include macular, papillary, papillovesicles, plaque, and lichen-like lesions. In differential diagnosis includes prurigo, erythema multiforme, lichen citrus chronicus, and atopic dermatitis. Then polymorphous light eruption clinical patterns are shown as follows: eczematous PMLE on neck and face, and multiple skin colored to lichenoid eruption over elbows. In photocontact dermatitis, phototoxic and photoallergic are two entities. Phototoxic is common, non-immunological, sunburn is often seen and is clinically diagnosed. While photoallergic is less common, it's a type 4 hypersensitivity disorder. Eczematous lesions are seen and is diagnosed by photopatch test. Systemic topical drugs, chemicals, contactants in combination with UVA spectrum induces phototoxic and photoallergic reactions. Phototoxic reactions have two types: topical, perfumes, dyes, soarlans, stars, plants, lime, and celery. Systemic, such as soarlan, tetracycline, and phenothiazine. Then here's a photograph of phototoxic reaction. Soarlan induced erythema and bullae on the shins in the case of vitiligo. Then topical include perfumes, soaps, aftershave, sunscreen, neomycin, halogenated compounds, parthenium, and Congress grass. Systemic drugs include NSAIDs, phenothiazine, and thiazides. So here's a photograph of parthenium dermatitis. Then approach to photosensitive disorder. A detailed history is very important, which includes age, sex of the patient, occupation and hobbies, family history of similar disease. जो भी कुछ बोलना है आपने क्लास फॉलो प्लीज, कुछ खत्म होने वाला है. And time interval between exposure and symptoms is very important. In contactant and drug history, in cosmetics and sunscreen usage. Clinical diagnosis: photo-exposed areas includes the face, V area, nape of neck, dorsum of hands and feet, extensive of arms and legs. Check the clothing use. ये check कर सकते हो. You can check if suppose you're wearing short sleeves, तो वहाँ पे होंगे. And you have to ask the patient कि what often type of clothes do you wear. Because for that reason, you have to tell them to wear closed exposed shirts. Spared areas include under hair fringe, chin, nose, upper eyelids, behind ears. Morphological pattern depends on etiology. Investigations: these are done depending on etiology. Connective tissue disorders include metabolic, genetic, ANA, dsDNA, porphyrin levels such as blood, urine, stool, and chromosomal analysis, cell mutation studies, and DNA repair assessment. Biopsy is done, and photo testing and photopatch testing. Treatment: first, most important is photoprotection. Natural includes ozone protection, melanin, and keratin. Physical includes clothing, broad-brimmed hats, and umbrellas. Topical includes sunscreens and UVA and UVB therapy. Systemic include beta-carotene, chloroquine, hydroxychloroquine, and PUVA. Treatment of causative factor: removal of offending drug, chemical and contactant, steroids, and immunosuppressors such as azathioprine, cyclosporin, and thalidomide. Sunscreens are there topical. They may be either physical or chemical. Physical sunscreens, they reflect and scatter light. These include zinc oxide, titanium dioxide, and ferrous oxide. In chemical, these absorb light and prevents penetration to skin. This includes anthranilides, benzophenone, cinnamates, and salicylates. Then broad spectrum sunscreens include UVA and UVB protective. These are SPF 15 or higher in Indian skin. SPF is sun protective factor. Proper application and use in all seasons is needed. Liberal and uniform application to photo exposed areas are to be applied half an hour prior to sun exposure. 1 ml is done over the face in females and 1.5 ml over face is done in male. Frequent reapplication is involved in vigorous exercise or swimming. Then we come to urticaria. It is a reaction pattern consisting of erythematous transient itchy swellings on the skin. Urticaria is derived from the word urtica, Latin means stinging nettle. Pathogenesis is by enhanced vasodilatation plus vasopermeability, plasma leakage, followed by wheals, which further lead to histamine stimulating nerve endings, which goes on to produce pruritus or itching. This is causing neuropeptide release. This leads to a skin response, also known as a flare. It's basically a response to histamine disease from cutaneous mast cells, often seen in angioedema. Does anyone know what angioedema is? Anything? Hmm? हाँ. तो present कैसे करता है? How does the patient come? Okay. Lips are swollen and eyes are swollen. Causes are exogenous, endogenous, and physical and emotional stress and idiopathic. Causes exogenous include inhalants such as pollens, house dust, fungi, dander, ingestions such as foods like fish, egg, brinjal, food additives, dyes, and preservatives. Drugs include penicillin, NSAIDs, sulfanoids. Contractions include bee stings and insect bites and plants. Endogenous are infections such as gastrointestinal, respiratory, urinary tract infections, bacterial, protozoal, helminthic, viral, such as cytomegalovirus, Epstein-Barr virus, and herpes simplex. Systemic diseases include Hashimoto's thyroiditis, SLE, chronic active hepatitis, and malignancies. Causes of physical urticaria: cold urticaria, which affects hands, ears, nose, and lateral thighs. Cholinergic urticaria includes fever, hot baths, and exercise-induced urticaria. Then solar urticaria, which is sun-induced pressure such as tight clothing, soles, and other weight-bearing points are often common sights, and dermographism is often seen. So here are the factors causing urticaria: solar, food ingestions, birds, etc. Drugs. Types of urticaria by duration are classified as follows. Acute urticaria presents hours to weeks. It's idiopathic in 75% of cases. Chronic urticaria persists beyond 6 weeks. It's idiopathic in 95% of cases and may be related to autoantibody to IgE. Clinical features are symptoms such as pruritus. Signs include characteristics such as hives or wheals. Hives or wheals means डाफर, जैसे मच्छर ने काटा या मक्खी ने काटा, उभरे ऐसा होता है. It spreads with scratching and coalesces to form a large patch. Course of lesions last 90 minutes to 24 hours. Patient says कि मुझे सुबह हुआ, वो शाम में ठीक हो गया, या 1.5 घंटे में. Classical wheals here seen. Evanescent edematous wheals. Drug-induced urticaria in patient with zoster. This is a carbamazepine-induced urticaria in the case of zoster. Notice spraying of the area of zoster. Herpes यहाँ हो रही है और यहाँ पर स्पेयरिंग हुई और यहाँ पर urticaria हुई है. Scratching results in more lesions. There are linear wheals following scratching. किसी को होता है यहाँ पर, जैसे हमने खुजाया फिर लाल लाल लाइन बन गई, किसी को हुआ होगा खाने पीने पे, खट्टा चीज खाया होगा. Dermographism is a condition where linear wheals are elicited by stroking or scratching the skin. These wheals subside within 30 minutes. Some patients have chronic dermographism which may persist throughout life. So here's an example of dermographism. It's an exaggerated triple response of wheals. Angioedema is a non-pitting subcutaneous swelling. It's well demarcated and it's a distribution of face, hands, buttocks, genitalia, abdomen, and laryngoadenoidoma. Anaphylaxis is a medical emergency. So here you can see angioedema, swelling of lips due to edema of subcutaneous tissue, and swelling of eyelids. Workup in a patient of urticaria. Careful history is to be taken, such as travel and work history, ingestion of foods, medications, herbals, and vitamins. Recent infection if necessary. Negative history makes finding cause more difficult. Known allergies, if any. Family history of allergy or thyroid disease. Investigations include consider a brief panel depending on history. These include hemoglobin and CBC, urine analysis, stool analysis, ESR, liver function test, PSH in ANA. Skin biopsy. If lesion is present for more than 24 hours, consider urticarial vasculitis. And now autologous serum test is also done. Treatment. Management is of general. Rule out anaphylaxis. Discontinue offending drugs, food or behavior. And reassurance should be offered. Discuss the idiopathic nature of chronic urticaria. It is unlikely to identify specific cause. Step 1. Non-sedating antihistaminics such as fexofenadine. These are less effective antipyretic as compared to sedating antihistaminics. Consider for daytime urticaria symptom control. Step 2 is sedating antihistaminics such as hydroxyzine. This should be done in nighttime and refractory to step 1. Beware of sedation and risk of fall in older patients. Step 3. ACE2 receptor antagonist. Add ACE2 receptor antagonist. Then other antihistaminics such as doxybine and cycloheptadine, leukotriene inhibitors, montelukast and zafirlukast, and systemic corticosteroids, prednisolone 20 to 40 mg PO. Then caution, this process may flare when steroids are weaned off. Thank you. अच्छा ये बताओ फोटो क्विज पहले चैप्टर कौन सी था आपने अर्टिकेरिया से पहले गैस गलत सही doesn't matter PML ठीक है गुड थैंक यू